Hi, today is Wednesday, March 26th, 2025. This article is from theheartysoul.com again, and this time the author is Catherine Fouquier. It was written on March 8th, 2025, quite a recent one. There was a byline, and the subject is a 5 concerning red flags that may signal colon cancer. When TikToker Radwa Oda shared on social media that she had been diagnosed with colon cancer, her main intention was to prevent others from ignoring the same warning signs that she had ignored. Her message, which showed how simple it is to ignore symptoms that could indicate something life threatening, hit a chord with thousands of people, right? It hit a chord with thousands of people. If you have any of these symptoms, please don't panic, but do see a doctor, advocate for yourself, she emphasized in her viral video. Though colon cancer is typically associated with older adults, it can affect people of any age. What makes this disease particularly dangerous is how quietly it can progress before causing noticeable symptoms. By the time clear signs appear, the cancer may have already advanced. Let's explore 5 warning signs that shouldn't be ignored and symptoms that Radwa and many medical professionals want you to know about. 1. Changes in stool shape. Most people rarely pay attention to the shape of their stool, but changes here can mean something. Consistently thin or pencil-like stools might show a problem that deserves medical attention. Why does this happen? When a tumor or other obstruction begins to block the colon, it can restrict the normal passage of waste. This narrowing creates thinner stools that sometimes resemble a pencil in width. Bowel movements can be temporarily affected for several reasons, so the occasional thin stool is not always a reason for worry. However, you should speak with your healthcare physician if this change continues for a few weeks. 2. When your bathroom routine shifts. Has your bathroom schedule suddenly changed without explanation? This could be one of the warning signs of colon cancer that shouldn't be ignored. Colon cancer can seriously disrupt the normal bowel process, resulting in more frequent trips to the bathroom. Some people experience persistent diarrhea, while others might feel a constant urge to go but struggle to pass through. These disruptions happen because tumors can interfere with how your colon operates, either by creating blockages or irritating the intestinal lining. What makes this symptom particularly tricky is how easily we blame bathroom changes on diet, stress, or minor illnesses. If increased frequency continues beyond 2 weeks, especially when accompanied by other signs of colon cancer, then it's time to consult a medical professional. 3. Persistent fatigue. After a long day, it's common to feel exhausted. It's strange to feel worn out all the time, even if getting enough sleep. Fatigue that doesn't go away with rest may be a sign of several illnesses, including colon cancer. When you suffer from a major illness, your body uses energy to fight it off, which leaves you feeling exhausted all the time. This fatigue may be accompanied by other symptoms such as lightheadedness or breathing problems. Lightheadedness, right? Lightheadedness. Yeah, I have to remember that. Lightheadedness. Giddy, dizzy, lightheadedness. Many people brush off fatigue as simply part of a busy lifestyle or aging. However, unexplained persistent tiredness that affects your daily life deserves medical attention, especially when combined with other digestive systems, right? Brush off fatigue. Many people brush off fatigue. For abdominal pain, the warning signs, warning signal. I don't have abdominal pain. Radwa Oda shared that one of her earliest symptoms was pain on the lower right side of her body, just beneath her breast. For months, she blamed discomfort on her bra being too tight, a reasonable explanation that slowed down her diagnosis. Abdominal pain, especially on the lower left side, where the sigmoid colon is located, can be one of the key signs of colon cancer, indicating a colon blockage. When a tumor blocks the intestine, it can cause intense discomfort that over-the-counter medications can't relieve. We are all guilty of rationalizing pain and blaming it on something we ate, stress, or even our clothing. But ongoing abdominal pain, especially when it's in the same location repeatedly, is among the common symptoms of colon cancer that calls for a professional opinion. Our clothing, right? Our clothing. 5. Persistent bloating. Occasional bloating happens to everyone. Persistent bloating that causes significant discomfort is different. Colon cancer can create blockages in the intestines, resulting in gas buildup, swelling, and abdominal discomfort that doesn't resolve with dietary changes or time. The bloating may be accompanied by feelings of fullness even after small meals. Many people, particularly women, have normalized feeling bloated. However, when bloating becomes a regular event without clear triggers, it's worth mentioning to your doctor. This symptom becomes particularly concerning when paired with other digestive changes. Persistent or unexplained bloating can be one of the signs of colon cancer that shouldn't be overlooked, especially when it occurs alongside other symptoms like changes in bowel habits or abdominal pain. While most cases of bloating are harmless, when it becomes chronic or severe with no apparent cause, it could indicate something more serious happening in your digestive tract. Early detection makes all the difference. A colon cancer, when caught early, has a higher survival rate. The challenge lies in recognizing subtle signs of colon cancer before the disease progresses. Remember that having these symptoms doesn't automatically mean you have cancer. Many other less serious conditions can cause similar issues, from irritable bowel syndrome to nutrient deficiencies. However, persistent changes warrant professional evaluation. Early detection remains one of the most effective weapons against colon cancer. Understanding the warning signs of colon cancer and seeking medical attention can make all the difference in treatment outcomes and quality of life. Don't hesitate to discuss any unusual digestive symptoms with your healthcare doctor, even if they seem minor or embarrassing. A vital reminder to listen to your body and prioritize health. Radwa Oda's story reminds us of the importance of listening to our bodies and seeking medical advice when something doesn't feel right. Had she recognized her symptoms earlier, her treatment journey might have been different. Regular screenings become increasingly important as we age, but awareness of these warning signs is valuable at any age. Healthcare providers recommend colonoscopies beginning at age 45 for those at average risk, but younger individuals with concerning symptoms or family history should discuss earlier screening with their doctors. Your health deserves your attention. Your body sends signals that something might be wrong. Listening could save your life. Disclaimer: this information is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and is for information only. Always seek the advice of your physician or another qualified health provider with any questions about your medical condition and/or current medication. Do not disregard professional medical advice or delay seeking advice or treatment because of something you have read here. So, good advice. Stool is important, right? The shape of a stool. Before I close the article for the day, there's something that I would like to go over, right? Our clothing, not clothes, but clothing is some different. Brush of fatigue, brush of fatigue, brush of fatigue. Lightheadedness, lightheadedness. Hit a chord with thousands of people. 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 Lightheadedness. Brush of fatigue. Our clothing, right? Our clothing. Brush of fatigue. Lightheadedness. Hit a chord with thousands of people. Well, that's it. Thanks for listening. Have a wonderful Wednesday.